This third video in the series on conducting a critical appraisal will examine 5 additional questions. Was the study performed in line with the original protocol? Deviations from the planned protocol reduce the power of the study to demonstrate significant findings. They also reduce the extent to which the results can be generalized to real-world situations or applied to your context. Differences include changes to the inclusion and exclusion criteria of the study's participants, failure to recruit the planned number of participants, or changes to the duration of follow-up of participants. Determine if the study's hypothesis has been tested. The hypothesis is a prediction by the authors that states the expected or predicted outcomes of the study to be tested, confirmed, or refuted. Look for evidence that the hypothesis has been addressed in the study. Was the statistical analysis performed correctly? This information is generally found in the Methods and Results section of an article. How was the data collected? The collection methods used for the study should be clearly stated. Consider if the method was appropriate for the study design. Is the complete data available? This enables the reader to check the statistical accuracy of the article, check if any data is missing, and that any omissions have been identified. What statistical tools were used to analyze the data? They should be appropriate, clearly described and justified, and relate to the original research question. Are the results of the analysis displayed in an appropriate form? There should be clearly laid out tables, graphs, and charts which support the discussion of the findings. You should be able to easily distinguish the study's results from the analysis of those results. Determine if all the participants who entered the study are properly accounted for at its conclusion. It is rare for all patients who enter a study to still be involved at the end. They may withdraw or adhere poorly with the treatment. The number that drop out should be reported and be included in the analysis. Consider if this number affects the validity of the study's results. Does the data justify the conclusions? This information is generally found in the discussion and conclusion sections. What are the key findings? Do the results clearly answer the question originally posed by the authors? There should also be discussion of any limitations of the study and recommendations for clinical practice and for further research. Consider if the conclusions drawn are justified. Are the findings reproducible and recognizable? Have the authors presented sufficient detail to assess the credibility of the findings? And are the results generalizable across a broader patient group? Look for claims that are not accurate. Consider if problems with the statistical analysis or the collection of the original data prevent clear conclusions. Is there a focus on findings that are too small to be statistically significant? A useful technique is to draw your own conclusions from the data before reading those of the authors. Are there any conflicts of interest? Look for a statement regarding conflict of interest at the end of the article. Financial or other personal considerations may affect the objectivity of the researcher. In particular, conclusions associated with funding from commercial firms, private foundations, and government organizations have the potential to bias and discredit research. Researchers must provide information on any sponsors of the study and disclose any potential or actual conflicts. Identification of a potential conflict of interest does not necessarily mean the results of a study cannot be relied upon. Consider whether they have been recognized, how they have been dealt with, and if this has influenced the validity of the study's findings. Part of the clinical appraisal process is working out if the study's findings apply to your clinical practice or research. Consider whether the treatment or test is feasible in your setting. Is your patient different from those in the study? Will the potential benefits of treatment outweigh any potential harm? In short, would you change practice based on the evidence, and are the findings applicable to your research? The goal of critically appraising literature is to determine the trustworthiness of the evidence and its value and relevance in a particular context. This is loosely based on the Centre for Evidence-Based Medicine statement. Critical appraisal is the process of carefully and systematically assessing the outcome of scientific research, the evidence, to judge its trustworthiness, value, and relevance in a particular context. The careful assessment of the study design is a core part of this process. Steps such as the evaluation of the statistical method used, interpretations of the findings, and determining if there's any potential conflicts of interest are also essential. This list includes resources used in the making of this video series. These provide more detailed information on how to conduct a critical appraisal.